I'm Amanda, and I was diagnosed with early ovarian cancer in November 2018. I went on to have a big operation and chemotherapy and lost all of my hair. And this is me 18 months later. So as a nurse and a cancer nurse for over 35 years, it was a very strange transition to being a patient. I wasn't sure how I would feel about losing my hair. I've supported so many women who've been through that experience, but I still didn't know how I'd feel myself. Strangely, having chemotherapy itself didn't faze me. I've seen so many people doing that, and I knew how to manage the side effects. That wasn't the thing that worried me, but I wasn't sure how I'd feel about losing my hair. About 10 days after my first treatment, my hair started coming out in handfuls. So I was very lucky in that I'd met Jasmin already, and I called her and had a chat with her about how I felt about it. I also talked about the fact that my scalp was incredibly painful with the hair that was coming out, and Jasmin talked to me about trying to massage my scalp with some tea tree oil, which made a huge difference. It made it so much more comfortable, and I would not have had that advice elsewhere, I don't think, and it made a huge difference. But Jasmin kindly agreed that she would shave my head for me, and I went to her salon, and it was the best thing I could have done, because although it was upsetting, it was the right thing for me at that time, because it felt like I took control. And actually, you see the pictures of me after it was done, smiling and feeling better about it.
Yeah. Oh, Mandy, I mean, I remember you coming, and we went through that same wave of emotion we're both having now, actually, because,
Yeah.
you know, with all the hairdressers I work with and as a coach, I always say we need to feel it with the lovely people we get to stand side by side with, and I feel it now.
Yeah.
And you had that courage, didn't you?
It's very strange, because it was a very emotional experience. However, it was a really positive experience, and it was the best thing I could do for me at that time. I had a new confidence with my shaved head, actually, and I felt less conspicuous with my shaved head than I did wearing my wig at times. I almost wore the wig if I felt other people wouldn't cope with me without it. So I went to a friend's birthday party and I wore the wig. Perhaps because I was going to see a lot of people I didn't know that well, and I didn't want to have to do that, oh, what's happened to you, and have that conversation time and time again. But I did feel surprisingly confident with a shaved head, as that was the new me. Thinking about the role as nursing advisor to cancer hair care, I hope that we can get information to every cancer nurse who is working with patients who've lost their hair. What I'd like to say to them is, often these are the areas that we struggle with in practice. We have some basic information. Some of us have more knowledge than others around hair loss and hair care, but none of us are experts in this field. What we have here is an opportunity to work with the experts, people who really understand and know about the causes of hair loss, how the hair cycle works, how hair regrows, but more importantly, they can advise us and help us learn so that we can support patients ourselves. We're never going to be the experts as nurses, and we very easily go to other experts while we're supporting patients. We wouldn't think twice about asking a physio or an OT to see a patient. We wouldn't think twice about asking a counsellor or somebody else to see our patients. So we shouldn't think twice about asking a hair expert to see our patients. And as an expert cancer nurse, and now as the nursing advisor to cancer hair care, what I'd really like to say is we're here to help. And if you have any questions, any worries, any concerns, we're always on the end of the phone. There's loads of information on the website, and we'd really like to hear from you, because we would like to support you with anything that you need from us going forward.